Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of this useful, you're of course welcome to take it and use it as you see fit. Just please make sure you do so safely. I wanted to show a progression today of the scapular weighted retraction exercise that I've shown in previous videos. This is really good just as a rehab tool for people who have shoulder issues, upper back issues, neck issues. But as we progress through a rehab program, I like to use the scapular retraction mobilization exercises and strengthening exercises as the platform for which all pulling exercises in the gym are based. So then when you do sort of pull-ups or pull-downs or any rowing motions, you will be primed to use the scapula in the most optimal way. So I've shown this in previous videos using a band, which is good. You know, I like bands. They're cheap, they're transportable, they're easy to, hook up to something. But of course, bands have their limitations. There's a sort of non-consistent strength curve. The further you pull the band, the harder the exercise gets. And that's often suboptimal for a lot of exercises. And of course, you can only load them so much because it's just a rubber band at the end of the day. This is where kettlebells, dumbbells, barbells, things like that really come into their own as the best strength training tools we have, because you can just progressively overload all of them. So I wanted to show a weighted scapular retraction here on the bench using just some really nice light kettlebells. But of course you could use dumbbells for this as well. So all we're gonna do is we're gonna lie on the bench, facing down, nice comfortable position. I'm about 45-degree angle here. This is just because I've got long arms. There's nothing magical about the 45-degree angle. You can be more horizontal if you wanted, but I wouldn't be more vertical than this. And we're going to do the exact same thing. So if you can imagine, if I was standing up, I would be in that same sort of scapular punch position for that initial rehab exercise. And we're just going to do the same thing. I'm going to retract the shoulder blades and then come back down, protract. So retract and retract and protract, retract and retract. And you can see I'm only moving at the shoulder blades. I'm not moving at the shoulder joint. I'm not moving at the elbow at all. I'm not sort of bending the elbows yet. And you can get quite a significant range of motion just from using the scapula. And like when we do this with the band, as I demonstrated in previous videos, we can then use this pattern as the basis for all our pulling motions in the gym. So what we do is we retract and then pull. And so we retract and then pull, and we practice it like that for a while until eventually we're doing the full motion with the retraction and the pull all as one. We do this because the scapula, if we don't tell them to work, they have a tendency to be a bit lazy. And so we just end up sort of rowing with our arms. We don't want to do that. We want to get the scapula involved in all of these exercises. And this is a great way not just to mobilize and strengthen the scapula in isolation, but also to make sure when we're doing our big, strong functional exercises that we're doing them with the best sort of biomechanics that we possibly can for long-term, particularly shoulder health, but health in this entire sort of periscapular region, the shoulders, the scapula, the upper back, and the neck. So that is the weighted scapular retraction on a bench with weights. Hope you found that useful, and I'll see you at the clinic.